cramps but no period, causes and tips to relieve distress. Cramps and pelvic pain are usually considered a sign of the onset of the menstrual period. Prostaglandin, a lipid hormone-like compound, causes the muscles of the uterus to contract, to expel the unfertilized egg in the uterus lining, resulting in cramps during menstruation. However, sometimes, a woman may experience cramps, yet no period. Such an occurrence can be worrisome for many, as they rush to pinpoint the cause. There may be several underlying medical reasons for such a condition. Here are top 10 reasons you get cramps, but no period. While most women may be able to differentiate between cramping related to the menstrual cycle and other cramping situations, at times the symptoms can be confusing and situations like cramping, but no period may need further examination. Some of the likely reasons for getting cramps without period can be 1. Pregnancy. Period pains, but no period. Could I be pregnant? Dash may be the most likely conclusion. Cramps which are not followed by menstruation can be an early indication of pregnancy. Cramping may occur when the fertilized egg implants itself to the uterine lining. In such an occurrence, you may experience minor cramping or implantation pain, usually around the time the periods are due, for about 3 to 4 weeks into the pregnancy. 2. Delayed period. Menstrual cramps, but no period may be due to a late period. Cramping may be the result of ovulation, release of eggs from the ovaries, taking place. Ovulation normally takes place around 10 to 15 days before the start of the period. Though, ovulation may get extended, at times, causing a delayed menstrual cycle. Some women may miscalculate their period date or suffer from irregular period. In such instances, period pains without menstruation may cause anxiety. 3. Menopause. Menopause indicates the end of a woman's monthly menstrual cycle and fertility. It usually occurs around the time a woman turns 50. In some cases, a menopausal woman may experience cramps during the premenopause phase, when the menstrual cycle starts changing and ovulation does not occur on a regular basis. 4. Inflammatory bowel disease. Inflammatory bowel diseases, IBD, like Crohn's disease and ulcerative colitis can be responsible for causing cramps, yet no period. Ulcerative colitis is related to the colon, whereas Crohn's disease adversely affects the digestive tract's lining. IBD typically produces symptoms like swelling, redness, irritation, and pain, collectively affecting the gastrointestinal parts, including the mouth, stomach, esophagus, small and large intestines. In the case of Crohn's disease, cramps can be experienced on the lower right side of the stomach, and with ulcerative colitis, cramps may be felt on the lower left side of the belly. 5. Ovarian cyst. Ovarian cysts or fluid-filled sacs on the ovaries can be another cause of cramps, but no period. In most cases, the development of ovarian cysts may not be a cause for worry and do not normally produce any symptoms. Occasionally, some women may experience lower abdominal pain or cramps, especially if the cysts grow in size and rupture. In these cases, appropriate treatment can relieve pain and discomfort. 6. Eating disorder. Cramps, with the absence of period, may stem from eating disorders like anorexia and bulimia. Bulimia is a serious eating disorder, characterized by binge eating and then purging to avoid weight gain, while those with anorexia may resort to food limitations to remain thin. Women who suffer from bulimia and anorexia may experience cramps and irregular periods, or no periods at all. 7. Ectopic pregnancy. In case of ectopic pregnancy, the fertilized embryo implants itself outside the uterus, more often than not, in one of the fallopian tubes. A woman with an ectopic pregnancy can experience mild cramps or one-sided sudden, sharp piercing pain, which may reach the lower back or shoulders. 8. Endometriosis. Endometriosis is a disorder which causes the tissues and cells that usually line the uterus to flourish outside the uterus. Endometriosis can lead to the occurrence of cramps in the lower abdomen, pelvic area, and lower back. The cramps may feel similar to those experienced during a period. 9. Pelvic inflammatory disease. Pelvic inflammatory disease, PID, is a bacterial infection of the upper part of the female reproductive organs, namely the cervix, uterus lining, fallopian tube, ovaries, and vagina. The infection is usually transmitted through sex and can result in painful cramps. The cramps can occur anytime during the month. Intense cramping may happen around the pelvic area or lower abdomen. 10. Appendicitis. Mild or painful cramping is a normal symptom of appendicitis. In some cases, the cramps may become so intense that activities like sneezing, coughing, and moving can cause considerable pain. When to consult a doctor? Cramps, but no period can be a stressful time, as you try and determine the cause of trouble and whether it warrants a consultation with your doctor. If this is the first time you've encountered cramps without a period, take a deep breath, and read below, to know when you should consider getting a medical consultation. If your cramps persist or return in intervals, it could be indicative of a deeper issue that must be treated. Look for any abnormal changes in your body or symptoms other than cramps, to narrow down where the problem lies. This can also help your doctor accurately diagnose the cause of cramps without period. If you have COD or a thyroid disorder, cramps could be an indication of hormone fluctuation. Consult your gynecologist or endocrinologist for further examination. Cramps could also point at ovarian cysts or fibroids. If the pain persists or you have a history of cysts or fibroids, consult a doctor for treatment.